Welcome to our Hello Health podcast. We are a physician-exclusive angel investment group that advises, connects, and invests in disruptive healthcare ventures. My name is Rupen, and I'm an oncologist and a Hello Health fellow. And today we will interview Dr. Norm Silver. Hello, everyone. Welcome back to another episode of the Hello Health podcast. My name is Rupen. I'm your host. And today we have a very special guest with us, a physician entrepreneur. And usually physician entrepreneurs bring a very unique flavor to the podcast because of their unique backgrounds. Today I have the honor to have Dr. Silver. He's the founding person and the CEO of QDoc. He has a wealth of experience, and he's going to share that with us today, and tons of experiences he did as a physician, as an entrepreneur. Dr. Silver, welcome.
Well, thank you, Rupen. Thanks. Great to be here. As you mentioned, I'm a pediatrician by training, and I've been in healthcare for 23 years. Started in Peds Emerge and kind of went through some entrepreneurial journey from there, mainly in the last 3 years, though.
Wow. So what happened? Can we go to like 3 years from now? What happened? Like, let's go back 3 years. What happened? Why did you go to entrepreneurship?
Maybe I'll start not the beginning when I was born, but I'll start with I know I've always been kind of interested in it's about interested in fixing problems, right? So you see a problem, there are different types of people. Some people complain about the problem. Some people don't complain and they just roll with it, which is fine too. And then I was always drawn to trying to find a problem, but then find solutions for it. It's always been something that's been in my DNA, I guess, from the beginning. You start with Peds Emerge, and I started with a couple of projects through there, and helped with flow. And then we had some opportunities in the last, really 15 years to do smaller projects, a couple of small businesses. But then about 3.5 years ago, things changed a little bit in the public system. COVID hit, right? About 5 years ago, I guess it was.
Yeah.
5 years ago now. And there were some changes in the way the public system viewed virtual healthcare. So we saw an opportunity to help provide care to everyone, as opposed to just the people that could afford it or people that have insurance. So that's where QDoc started. With QDoc's mission to provide equal access to quality medical care to all, regardless of geographic location or socioeconomic status. And so that is something that we always strive towards, a vision of everyone having equal access to care, which in a public system you can do, but it is something that has to be enabled by the environment you're in. So we took, I won't say advantage, but we saw the opportunity to provide better care to the population because of the infrastructure that we're working in right now. But I could tell you what QDoc is.
I would love to hear more about QDoc. So what is QDoc?
Very local right now.
To define it.
Yeah, so QDoc, right now, QDoc's a medical technology company with the primary product of a virtual healthcare platform. What we do is connect patients to physicians and nurse practitioners now in real time by encrypted video. We use a patent pending unique work distribution process that will look for the right physician for that particular patient. And then they have a video-to-video connection. During the video connection, they take a history. We've just launched an iPhone app, and we'll be integrating HealthKit, so the doctors will be able to see heart rates and EKG, and there are IoTs that we may integrate, so you can hear breath sounds and hear heart sounds while you're seeing the patient. And then after the visit, we have built an encrypted and certified billing software that we can automatically bill for the physician visits. And then we also have built an electronic medical record in the background to chart with. And then patients can, when they're seen, can be, we send prescriptions to their local pharmacy if they need it. We can do X-ray, we can do labs, consultations, and then we do follow-up as well. But the real patent pending and special part of this is that we have a unique way of finding the right provider for the patients. So if there's a child in a certain area, geographic area, we will look for a pediatrician first. The call out goes by text. The first doctor to answer that call out gets the visit. So it's like Uber. Uber for medicine is what kind of it's like, but it's much more tailored, right? So, um, yeah. So just to finish that thought, for instance, like when you have a child in a certain area, they'll look for a pediatrician first. After 5 minutes, if nobody takes the call, then it goes to physicians that could see children in the area, and then physicians that could see children in the whole network. So we keep escalating the call out to more and more physicians and nurse practitioners.
I would say it's more like precision medicine rather than Uber because like it's li literally treating the patient by what they need according to their circumstances.
Yeah, it's like it is that way, but within the precision, there are multiple providers and then that's when it becomes more like Uber, right? So it's
Gotcha.
like having if you think of Uber or Uber Eats, let's say, it's like you order pizza and you look for the specialist to deliver pizza, the pizza specialist, but really anyone could deliver a pizza, right? So you don't always get the pizza specialist, but you might get, if you don't get it in a timely fashion, you get someone that can still fill your order, but it might not be the pizza specialist. So if
Correct.
that kind of makes sense, yeah. So
So I want to go back to like w when all this started. I know like you had some experience in fixing problems, but you wanted to uh, bring something like maybe bigger than just fixing problems in the hospital, creating a company. So what was the first step? Let's say I'm a physician, I found a problem.
yeah,
What was the first thing you did to start QDoc?
so I think what we realized, we got partners. So my
Mm-hmm.
co-founder Dave Berkowitz is a probably the top medical technology software developer in the country.
Mm-hmm.
So getting a good partner, and then
Team.
realizing your gaps, right? So we both had never run a large organization, and where we want to take this is much bigger than the local. We have some local startup clinics that we've started, and Dave and I did together. So we started the first urgent care clinic outside of a hospital in Manitoba,
Mm-hmm.
uh, our province. So we started that about 5, 6 years ago now, one clinic, right? So, and then we started a penicillin allergy clinic. Dave helped with that. Mainly it was me and another partner. And that's the first clinic of that sort in Canada. And we started a COVID testing site, Dave and I together, which I'll be operationalized and built the software within 8 days. So that was a crazy time. And with those experiences, we gained some insight into, how to operationalize something, how to hire staff, how to manage a staff. But we had never done a business with the scope that we were planning on doing this one. So, when realizing our gaps, we, engage a local startup community. So there's startup incubators in every jurisdiction, US and
Mm-hmm.
Canada,
Mm-hmm.
that you can join. So we joined one. We went into their base camp, they call it. We learned a lot about business canvases and well, that was my role. So business canvases and learned a lot about writing, how to write a business plan. We don't really write business plans anymore in general for startups, but using a business canvas to understand, validating that this was something that would be used. We knew pretty much that this would be used by patients because if you say to a patient, "Hey, would you prefer to go to emergency department and wait 6 hours? Would you prefer to wait for your doctor for in Canada? It could be months sometimes, or if you have one. Uh, would you prefer to go on and see a doctor by video for free within right now our wait time average is 20 minutes. Um, Obviously most people say, but we still did validate that. So we called a bunch of cold calls, talked to patients, and pretty much universally people would use this, right? They don't charge anything, it goes to the public system. The question we had was whether providers would use it. So,
Yeah.
the first thing we did was ask, and a lot of them said yes. But I
Mm-hmm.
didn't feel that was good enough because a lot of people say yes to things and then they don't end up going through with
Correct.
it. So I think as far as you go to validate that actually people will put pen to paper. So what we did was I created a application process as if it existed, and then we sent them all out, and we had a metric that we wanted people to provide. We wanted to get enough back that I would say, okay, we're going to get enough providers. So I sent out 20, and well, actually, I ended up sending out 10, and we got three back that were like fully filled out with their um, like the application was filled out. We sent those void checks, like we got everything as if it was starting. So we knew these people were definitely would come on, right? Otherwise, you don't know for sure. People can say yes
Correct.
in a survey, right? Doesn't mean much to me. So we only did 10 because we were going to do 20, but 15% was my cutoff. So I was like, we know we're going to hit it at 20 anyway, so we stopped. But once we knew that, then we built a minimal viable product. So that's a very limited functionality product. So we hired our first two employees in June of 2021. And then we had the minimal viable product built by October, and we started seeing a few patients by the end of October, beginning of November of 2021. All it could do was we set this at the beginning what we wanted the functionality to be, just proof of
Hmm.
concept. It allowed a patient to sign up, it allowed a doctor to sign up, and it
Hmm.
allowed the video to video connection between the two. At that point, we couldn't even bill. So for the visits, we couldn't really document well. There's a bunch of stuff that really was not, it's a minimal viable product. It's basically proof of concept. So probably 50% of the visits failed for some technical reason or other. But we knew that we had something there because very quickly we had people raving about the fact that it existed. We didn't really commercialize it in any way until May of 2022 when we didn't do any advertising, but we had media come to us and we allowed one or two articles to be published. And then we kind of went from there and started to grow.
Gotcha. I want to go back. So, how did you meet your partner, your business partner?
We've been friends forever. So we probably known each other for about 20 something years. And I'm very much a person that um, has to trust the people I'm partnering with.
Yeah.
I do start always with the thought that, that I can trust the person that I'm with.
Hmm. Hmm.
Um, and then until if they prove you wrong, then you move on. Move on to some other. But I need people that I trust. So it was a natural fit for him and I to work together. We've done things before. And then, for instance, our lawyer is a friend of mine now. Like we've had multiple lawyers in different firms, but the lawyer is a friend of mine from kindergarten that lives in Toronto.
Yeah.
Our accountant is someone that helped advise us for a long time, and now he's our in-house accountant. He's our CFO. It's always people. I always find it's people that I can trust and really, you really have to trust, and you have to find those people. We did put in the just to go back to the beginning. Dave was very, very good at the med tech, and he understands medicine because of that. And I was pretty good at I had very good domain knowledge in medicine. And I took a few, actually three programming courses so I could understand how they think, basically. So I got myself into that a little bit. But we did have those business gaps. So in addition to the startup community that we joined, I also engaged with three people that have been there and done that. So one that built a $1 billion company that IPO'd, another one that built an $800 million company that IPO'd the March before we actually started our company, and another one that was in Series C funding. So we got them as advisors, and that's been invaluable as well. We don't talk to them every day or even every month, but whenever there's a issue where I think I need some advice and they've been there, they've done it, they understand, we meet and they can kind of give some, just advice um, on how to proceed. But really, the first thing is just there's a few things. One, if you think it's a good idea and you want to do it, just start. You'll figure it out,
Yeah.
and that's the biggest thing: persistence. Because whatever the issue is, you can learn it. We're pretty smart. Physicians are pretty smart in general.
I
We
completely
can we
agree.
can learn we can learn how to go through it. You have to have significant risk tolerance, and you have to be willing to work for free for a very long period of time. You can't not expect that this is going to be something that you're going to be. Uh, not going to. You can't expect to get paid for the building of a company like this. I don't think. And from an
Yeah.
investor point of view, from a government funding point of view, it wouldn't look good if you're taking. I was an investor as well, and I don't. One of the things I look for is what the founders are getting paid, and if they're getting
Yeah.
paid too much, um, that's a red flag for me. If they're getting the flip side of that is they're not spending too much enough time on it. They have to work on other things because they're not financially able to take the time off, that is also a red flag, right? You want people to be able to work on it, and you definitely want to have passion for it, which we do. So if you
Gotcha.
don't have that, it cannot be for the nobody in their right mind would do this for the money.
I completely agree with you. It is very risky, as you said, but also it's very rewarding. I think like a couple of lessons here. Like I think the trust and knowing the person you go with, you go to business with, because like I think when you go to business with someone, it's just like getting married. You don't marry the first person that you meet on the first date. You have to date a lot, and then you have to go out with them and to know them well before going to business with. So you can't just like message someone and then go to a business because like you don't know how that person is going to be like risk tolerance wise, working for free wise, taking risk and like doing other stuff.
Right. Yeah, and you have to have complementary. There's no point in having someone that's exactly like you.
Yeah, two
Yeah,
physicians without coding exactly skills.
you have to have complementary skills, I think, because there's no point, and you have to define your roles. So very early on, we defined my role as CEO and Dave's role as CTO, but we're both co-founders. So we
Gotcha.
make big decisions together, but we have to define our roles. And I knew right from the beginning that at the beginning of it, setting it up and putting some staffing together and vision wise and things like that, that I would be doing way more work than him. And he was always trying to do work, but there was not, but I told him like, listen, right now I'm doing a lot of the work because business canvas and all that kind of stuff, right? But I knew that he would be at this point doing way more work than I am, and he
Yeah.
is. He's building the product, and the day-to-day stuff that he's doing right now is very remarkable. He's been amazing. We've been fortunate enough to be recognized for a bunch of awards. One of the best was he won last year the Globe and Mail Executive of the Year award for technology,
Wow.
so which is pretty cool. Like it was an only QDoc, but it's still pretty amazing, right? So that he could accomplish that kind of recognition. But really, it's not about that. The day after, we're thinking about the future, and it's always that's when we get excited, but what we can
Correct.
do in the future, right?
I want to also like touch base on other things you've done. So like you established other types of clinics like the penicillin allergy clinic and the minor injury clinic for kids. Were these experiences like before you started QDoc? These experiences prepped you for QDoc, or is this something that you did while you were doing QDoc? Like, what's the story like?
Yeah, so it's been stepwise, really. Like at the beginning, and also you have to be willing, like I said before, you have to be willing to do this stuff for free because there are definitely things that aren't on my resume or CV that have completely failed.
Hmm.
But you
Hmm.
do gain some experience from them. You don't want things to fail, but you have to move on and go, okay, that didn't work out. We'll move on to the next thing, right? So, the minor injury clinic for kids we established that in 2006, and we basically it was to offload all non-surgical orthopedic trauma in kids from orthopedic surgeons to outside of the hospital because they're getting overwhelmed with things that they weren't doing surgery on, and that is where they
Hmm. Hmm.
focus, not on the non-surgical. So we set up that clinic. We were fortunate enough to have the health minister come by within 3 or 4 months after establishing a pilot with the clinic, and they gave us full funding for a full-time clinic, which was lucky, right? I don't get lucky like that all the time, but we've been running that since 2006, and we have saved, well, we see about 8,000 visits a year there. The minor illness and injury clinic, it was something that it was another partner that came up, Dr. Brennan, who came up to Dave and I, and also Dr. Cabani, who's
Hmm.
another physician entrepreneur, and we thought this was a great idea to try, and it's basically a clinic that is run only by emergency physicians, and so we can offload a lot of things that would be normally seen in the emergency department, including fracture reductions, fractures, casting, X-ray, lacerations, like a bedside ultrasound, like all that kind of stuff can be done at that clinic, so they don't have to go to the hospital, and it's appointment based, much better for patients. The penicillin allergy clinic was was another partner, Dr. Mix, who's now actually also, given that trust issue and all that, is the CMO for QDoc, Chief Medical
Hmm.
Officer. But we started the penicillin allergy clinic together. It's another, 2-year wait list to see an allergist. So we set up outside of a hospital, protocolized, had some input from some allergists, and set up protocolized the testing for penicillin allergies and oral testing. And who better to do that because you're watching for anaphylaxis than emergency
Yes,
physician.
exactly.
Um, and then the COVID testing site again was just an opportunity, and that was really interesting because we were able to engage multiple partners, and there was a really significant appetite from the government to make this work. So we got a
Hmm.
lot of help.
Hmm.
We got people like we never would have been able to approach. So again, it's taking the opportunity that's given to you and making something out of it. So we were able to engage the city of Winnipeg because they had to put up a bunch of signs. We were able to
Oh,
engage
wow.
a local college that was able to, give us space and like cleared out all their heavy equipment so we can run it through their garages. We the province, the Winnipeg Regional Health Authority, which is our health authorities here, the basically the army, because we had to get some tents and stuff like that. They were connecting us with everyone so we can get things done. We had to overpay some of the staff initially because we had to actually hire and implement this within 8 days. And Dave wrote the booking software within 8 days. He had it all written and
Unbelievable.
uploaded. The Friday afternoon, we were supposed to open in the evening on Friday. He was having some difficulty securing it in the AWS, Amazon Web Services. So we got a specialist from the college that we were working with, and they worked together in the afternoon and just uploaded everything, and we had everything ready by that evening, which is pretty cool. When it was running, we had we based it on we were running through two cars, so it's a drive through, swab site.
Yeah.
2 cars every 5 minutes with up to 4 people per car. And we were able to run that with probably one, two, three, four, 5 people. We're running that at a time. So we had, and again, family. We had my son was there directing traffic. My daughter was there doing demographic checks and that kind of stuff. Dave's daughter was doing the same thing. And we had a bunch of nurses and doctors doing the swabs. So it was kind of very cool. Anyways, that was very
Very
cool.
interesting.
Yeah, it was very cool. And then QDoc, we just, I went to my Emerge, the heads of Children's Emergency where I was working and said, I really need to try this because I would regret not
Yeah.
trying. I earmarked like a bunch of money for myself to bootstrap it, and then not as many people are fortunate enough to have that ability to do that, which is very, very difficult for a lot of entrepreneurs. Not
Hmm.
physician entrepreneurs as much, but very difficult. But you have to be willing to like sacrifice that. So,
Yeah,
for me, it
exactly.
would have been, it didn't work out. It's going to work out now, right? We know. But to me, if it didn't work out, it's an extra couple of years that I'd have to work, right? It's not, but if it did, if it does, I would never regret it trying it. And to me, I could have raised money right away, but again, I just don't want to. I'd rather lose my own than bring because it's going to be your friends and family around, right?
Correct.
It's too much pressure. So we waited until we had that MVP running and it was working and people liked it, and then we raised some money because otherwise we didn't feel comfortable. And even with that, we told the initial investors it would be a 50-50 chance of total loss. Um, yeah, I didn't think it was going to be that high, but I didn't want to also overpromise. So,
Correct. Yeah. So you are doing many things at the same, I don't know if at the same time or no, but like you are involved in many experiences, a startup, entrepreneurship, and practicing physician. You mentioned your family. Like how? What's the secret sauce? Like how are you balancing all these things in life?
I think it's not all happening at once. So that's the one thing, right? So I think the secret I feel anyways, the secret of bringing a business to life and let it is that it can run without you. So it is
Correct.
making sure that operations and you have operations manuals and you have everyone knows what their role is, and that's what you do to make a business run. And then if you step away for like I am not involved in the minor illness and injury clinic. Now, to be fair, um, there is a managing partner that's there all the time.
Hmm.
The penicillin allergy clinic, again, my co-founder with that is mainly running that. But even for him, it's probably an hour a month of work because we have it very well operationalized. The COVID testing site ran on its own, like while we after we set it up, like we set away procedures and things like that. So that ran on its own. The injury clinic for kids, I still work there a little bit, but to me, it's once every 3 months I put a schedule together. That's my administrative tasks now, because everything else is already running. So, and we're trying to get QDoc. We'll get there. It's not there yet, but QDoc will get there. So we want to make sure that no one person is critical, because if they are, then you don't really
We
have
can't sell the business.
yeah, they don't have a viable business. So we try to yeah, we're not there yet, but we will have a full manual on how this thing runs. How do you hire? How do you fire? Everything will be protocolized, because if you don't have that, I'd like to be able to hand it over and say, this is how you do it. And you can call me when you need, but this is how you do it. So we're not there yet, but we'll get there.
I love it. I love it. So there are many lessons there, and like it sounds familiar to me because like I think me and you and read tons of books.
Hmm.
I believe we read the same books.
Yeah.
Uh,
Well, my
oh,
favorite I've recently read was Traction. I don't know if you've read Traction.
yes, I heard about it. I haven't read it yet. Yes, but I
It's
heard
very,
about it.
very
Yeah.
good. I haven't, I actually have a note in my calendar to reread it or skim through and start to implement some of the things. We've done some of it in it, and I really like that book. Um, One of the things we've done is about a year ago now, I guess we know what our mission is, and it's a very, very easy to understand mission and also for people to buy into. So when I say people, it's our staff, it's me. I like the fact that we have this drive to make sure that everyone has access to care. So that drives all of our partnerships. So we have a partnership with an organization called the Downtown Community Safety Partnership, and they take care of the homeless in Winnipeg. Now, with a partnership with us, the homeless can access care from the streets. They don't have to go anywhere. They can access care because we donated a couple of tablets, and their staff can now access QDoc from the streets of Winnipeg, and they don't have to go anywhere. That saves a ton, right? So they have what happens with a lot of the homeless is they don't want to go anywhere. They want to see a doctor.
Yeah.
So their whatever scratch turns into cellulitis, turns into a sepsis, and then they go to ICU for 3 weeks. As opposed to, oh, it looks like your scratch is getting infected. Let's connect you with the doctor, and we'll get you on antibiotics. It's
Correct.
prevented, right? We have partnerships with the First Nations communities. We have partnerships with pharmacies, the rural areas. It's a very easy mission to get your head around and be proud of. Our staff is very proud to work, for an organization like ours as well. The government is very supportive of what we're doing as well. And when you got to get investors, it's not only about the money. There's some ethical investing that you want to feel good
Correct.
about
It's about
the
the
money,
mission.
right? So you want to make sure that they understand what our mission is, and they understand that we're going to be building this out. So that you give you a lot of leeway when it comes to when are you going to be profitable, right? So you get a lot of leeway that way. But we also realize it's important to get there and the mission, but the way you get there. So that's what comes down to the values, right? So we have QDoc values. It spells QDoc. We have quality, diversity, ownership, and compassion. There's some verbiage around this stuff. But with this book that you're talking about, like that we
I
just
love
talked
it.
we have, and this was directly from the book, we call them QVAs, the QDoc Value Awards. So every month we give I gave out the first one. So I gave an award to one of our operation staff that exemplified one of our values and explained to them what they were. And then we go every 2 weeks now. So one's operations, and then 2 weeks later it's one of our technical staff, because they kind of work separate. So and they give an award. Now, what we do though and this is directly again from the book, is what we do is the staff member that won that award now is responsible for giving it out to the next person. And we encourage our staff to email or notify that person when they notice somebody doing something that exemplifies one of our values. So that gets them
Mm-hmm.
thinking of our
Mm-hmm.
values all the time. So the goal for that is we want, and again, it's the whole idea of getting the company to run without you. We're not huge right now. We're like 23 people, something like that. Once you get bigger, you're going to be able to, by example, show people how you want them to manage themselves, manage the business, manage other employees, manage their doctors, manage like patients. So if we have the values set out, people know what they are. People know what they would think. Okay, what would QDoc's values? How they want me to deal with this problem, right?
You're
Uh,
building a culture.
yes, exactly. And that's so important. So I really love these. Like I know you read these books, I guess too, and I really there's one thing about reading them, and there's another about actually spending the time to live them. So that's one small one we've done, and this is going to take a while to get through, and we're also very young. We're only 3 years old, so we're going to have to. It takes time. We realize it's a process. I'm really impatient when it comes to stuff, but I've learned to become much more patient with getting this stuff done properly. So, there's a saying, right? You can teach someone how to, you can feed someone a fish, or you can teach them how to fish, right?
Correct.
Uh, so, instead of there's multiple times where it would have been way easier for me to do something myself, but instead of that, we use that as a teaching opportunity. So next time, the time after, that staff member does it properly.
Mm-hmm.
Um,
Mm-hmm. Gotcha. I want to shift gears a bit now toward you talk about investment and investing with mission, and I think we are both very familiar with Hello Health. So I want to switch gears toward Hello Health. Like you're a physician entrepreneur, and I was wondering like how did Hello Health like benefit you and like or give you connections in your entrepreneurial journey so far?
yeah, so I mean, I'm pretty young to Hello Health. Like I think we've been around for 4 or 5 months now. I
Mm-hmm.
joined.
Mm-hmm.
I find it very, very interesting, and I love the idea of. I mean, I think it's very important to have domain knowledge when you're evaluating a company.
Correct.
Uh, and I love that about Halo Health. So I think that, I did invest in one or two. I think one for sure. I think maybe two, because, when a neurosurgeon says that this is game changing from a aneurysmal point of view, that's one of the companies, and I'm like, well, okay, I'm no expert, but like, if you think it's amazing and it looks like they're on their way, I'll definitely invest in something like that. I do find the biggest thing, because I'm involved with a bunch of companies, people come now for advice and things like that, and I do find the biggest issue I find is you have, like, and I mentioned this earlier, is to validate that you're going to be able to sell when you build it. Don't build it first, because that,
100% think
yeah,
backward. Think
yeah,
backward.
think
Yes.
about, yeah, that you can sell this thing if you build it. Then go ahead. Like, don't stop. Go ahead and do it. But I've seen so many times where, like you said, it's very difficult to integrate into healthcare. And if you don't see a way forward, don't just hope that it's going to present itself. Figure out a way that you might be able to sell whatever you're building, and then go ahead and build it, because and just build it shitty at first, see if it works.
Yeah,
That's what we
exactly.
did. Um, it doesn't have to be perfect at first. You try to get it better and better as you get along, right? So,
Yeah,
and that's
I completely agree with you with that. Like there are many points you mentioned. Like sometimes we are on a call and there would be like this company that are doing some. I'm an oncologist, so I have like tons of experience in drugs and drug development, but like I'm not a PhD person, right? And there would be this company that is like talking about this drug and how it works and the mechanism. I was like, this is above my head. So there would be a couple of PhD guys or like people like just okay, so this work, this doesn't work, and then like like you are being supported by like other people who have the expertise, and I think the network effect here is a huge because
totally.
like not at least anyone there like 4 or 5 years of experience and education in their field at least.
Now, yeah, I like the network, and I haven't been as involved as I want to be. I did one, I think I vetted or helped with one company. And it was interesting. Did some research. I brought in people that were better at me than understanding the company than I was in certain areas of it. Um, I know that when you talk about startups, like what is it, like 50% fail within the first year, and then 90% fail within five. You have to pick the ones that you think are really gonna do well, right? So, and the other thing I think, even if something's, I mean, I find a few of these companies, not Halo, sorry, mainly not Halo Health, but in general, the startups, when they are building something that really is cool and it does maybe save a bit of time, but then you have to ask yourself, what's the value to the user? Is it going
Correct.
to, are they going to pay enough to make it worth it? So there are some products, like I mentioned, we're not only a one product company anymore. We have like three products that we monetize now. But the question always is, the first step is always, would you buy this and how much would you pay for it? If it's not, even if it's like, yeah, it's pretty cool, I'd use it, but you know what? It wouldn't save me that much time. I'm not going to pay for, I wouldn't pay for it. Then there's no point from a monetary point of view to do this thing, right? There's a lot of companies, especially in the medical space, there's great ideas and people would use them for free, but you can't build a company on that, right? So you have to be careful.
Yeah. Yeah, it's just like research, like if it's statistically significant, it doesn't mean that it's clinically significant.
Exactly.
So,
Yeah, if I have to spend, and then you have to add in the monetary value of it. So, if something is like there's a 50% reduction in something, but the baseline is like 0.1% and it causes a mild illness or something, then great. Who cares? Sorry, and a 50%,
exactly.
but great. That's a great statistically, it's great, but nobody's going to pay enough for that kind of effect, right? So there's a lot of things like that we have to kind of really look at before you invest in something, I think.
Yeah. 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 We're almost at the end. I don't want to take more of your time. So my last question is, what advice would you give to physicians who are listening to this and they have an idea, they want to act on it?
I guess just to go, I back up again and go through it. Number one is just validate that it's needed. Number two is if it feels it's needed, then validate what you think, not just what you think, what people will be willing to pay for the product that you're thinking of building.
Hmm.
And then just go ahead and do it. Get the advice you need, ask for help. People will always be willing to help. Like it's a very supportive, entrepreneurs in general are very supportive.
Yeah,
Ask for the help you need, and then just go ahead and do it. I would very early on understand what your mission is, what you really want to do with your business, and create some values, because we didn't do that as early. Maybe we should have a bit earlier, but I love the idea of having a mission, having values, and do not compromise on those, but be willing to compromise on your approach to get there, because you're going to have to pivot many times to either go around something, go under it, go over it, go through it in order to get there. But your goal is always the same. And the way you treat people and the way your values are always the same. Keep those consistent, but the way you get there can be many number of ways. You have to be creative.
I love it. Dr. Silva, it has been awesome having you. And I learned a lot. I'm sure anyone who's listening to this is going to learn a lot. If you're a physician, you have an idea, this episode is a must. Thank you so much. I really appreciate your time being here today.
Thank you so much. Appreciate the your time. Take